in the month of January and we are delving more on the topic cervical cancer. Cervical cancer is real and we're going to keep talking about it until you get screened. I have here with me today Mrs. Carolyn Kudzawu. She's a nurse colposcopist and she's here to give us every detailed information about her profession and how it's related to cervical cancer. So please keep listening. I'll be right back with the interview. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes, it's made in Ghana and the taste is pure hair, quality hair for confident look. A special thank you to Star Bites Airport branch. Guys, come meet, eat and drink. Welcome back, guys, and I'm loving myself. Thanks to Pura Hair for my beautiful hair, my lovely makeup by Hair Luxury, and thank you, Najib, for this gorgeous bracelet. As I mentioned earlier, guys, I have Mrs. Kudzawu, who is on the show. She's a nurse colposcopist, and her job is very pertinent to cervical cancer. Welcome to Health in the Spotlight.
Thank you, Rina.
How are you feeling today?
Here. I feel good.
I can see that. So tell us, who is a nurse colposcopist?
Basically, a nurse colposcopist is one person who is a certified colposcopist or who can do colposcopy. When we say colposcopy is when you, as a procedure you go for after you've done your cervical cancer screening test, and then you need, say, treatment or you need further assessment. So any further assessment or any form of treatment after you've had your cervical cancer screening or you've had your cervical cancer test is colposcopy.
Oh, okay. It sounds new to me. Like, how many? Do you have lots of nurse colposcopists in the system?
No, really. For Ghana, for example, I think it's just me and then a colleague of mine. That makes two of us.
Charlie, they are well sorted.
What do you know?
You are well sorted, though. What's your job description?
Well, we really do a lot of screening. Anything after screening, you talk to us and then we sort you out. But comes up to Cervical Cancer Screening Center in Bato.
Okay.
They are training a lot of nurses, community health nurses, midwives to be able to do the basics of colposcopy. So there are a few nurses being trained to handle the screening aspect of cervical cancer, and then they can go a step further to treat in case you need treatment after screening.
Oh, okay. So with your line of, or with your field of work, what do you have a special unit in the hospital that people can come to you and then get your services?
Ghana is yet to embrace that policy or that kind of setting. Most facilities have the reproductive health unit, and then they are trying to incorporate the cervical cancer screening unit into it. Most facilities complain of space, they don't have space, and then you just have to squeeze in there. So in the meantime, they don't have any specialized unit or department for us in the hospital. But you can freely walk into any facility and request to have your cervical cancer test done, and then you'll be sorted.
You'll be sorted. Yes. So apart from the screening, you said after the cervical cancer screening, then where you guys have other things that you do? Is it like treatment or?
Yeah, so basically any form of treatment you receive after your cervical cancer test is colposcopy. So once you do your test and it's positive, we have to inquire further or do colposcopy to assess the extent of damage or to be able to weigh what exactly is going on there to make your test positive. So depending on your test results, you could have ASCOs, you could have low grade, high grade, you could have what?
Please, you are scaring us.
So
it has to
depending
do.
on your test results.
Oh, okay.
So two things: your test comes out either positive or negative. And once it comes out positive, we need to do further inquiry. That is called colposcopy.
Oh, okay.
So, like I said, there are just a few nurses. Ghana has not embraced that whole concept of nurses doing colposcopy. But in the UK, nurses really do colposcopy.
But why do you think Ghana hasn't embraced that?
Nkakra, we'll get there. Doctors have been trained to do colposcopy. So we have recently at the AGCM, we have doctors graduating from gynae oncology. So with gynae oncology, all those who specialize in gynae oncology, they are trained to do colposcopy. So at least you should know your way around basic colposcopy.
Is it like you keep saying colposcopy? Is it like an invasive procedure, or is it painful? Like, please tell our viewers, we want to know what to expect when you say colposcopy.
So when we say colposcopy, it's nothing invasive.
Okay.
Just like the procedure you went through to have your cervical test done, you get a speculum passed. There's a device or a machine called a colposcope. Okay. It's just a camera and a lens. So that light is projected through the speculum to view your cervix.
Oh, all right.
And then we view it in a bigger lens. And then in different shades of light to see the changes going on there.
In the cervix.
It's nothing painful, just a bit of discomfort.
Hey, when the nurse tell you
when
the nurse tell you it's a bit discomfort, please. That's just by the way. But what made you go into this line of job?
Since the beginning of my practice, I have had to work largely at the reproductive health unit and the gynae emergency room, and then the gynae OPD. And then I came to realize that women have a lot of issues to deal with when it comes to their health, concerning their reproductive health and all that. And then the leading factor was cervical cancer, because it turned out that we have of all the gynae cancers that are diagnosed yearly, 57.4% of that is cervical cancer. And it's not funny.
Yeah.
Women come with all sorts of pain, all sorts of symptoms. Their husbands don't want them. They are thrown out of the house just because they have some funny smells, funny odor, vaginal discharge, and all that. So you would realize that women go through a lot just to keep their home together or just to feel and look good. And a lot of factors goes into a woman trying to feel confident about herself, trying to look good, and all that.
Yeah.
And it wasn't a field of interest for anyone. I realized not a lot of people took particular interest in that. So I got a bit curious, and then I decided to poke further.
Okay, so that kind of like motivated you to go for it.
Developed my interest into it. And then way back in 2010, I happened to be an intern in the Catholic Hospital in Bato. And then we had to screen over 3,000 women. That was a pilot project we did.
Over 3,000 women for
cervical
cancer.
Dr. Kofi Efa. So we had to screen over 3,000 women for cervical cancer. We had to go into the remote outskirts town of Bato. Actually, we had to screen the whole of North Tongue district.
Whoa.
Yes. So we had to go to all the wildest places you can think of. We had to do a boat ride, cruises, got stuck in the mud.
Just to get clients to screen.
To get access to women in the remote part of North Tongue. Yes.
Wow.
Accra is not Ghana, and Ghana is not Accra. So there are women out there who need help.
Yeah.
And it takes a lot to get to them. Yeah.
So for someone who is listening right now and wants to be like you, be a nurse colposcopist, what's the requirements to be a nurse colposcopist?
Okay, so to be a nurse colposcopist, you need the basics of being a nurse or a midwife or a community health nurse, public health nurse, and then you come on board the training.
Where's the training?
Goes into the training.
Oh, okay.
Yes.
Where's the training?
For now, Bato is training. The Catholic Hospital in Bato is training health professionals to do at least the basic screening.
Okay.
So the basic screening comprises of how to do the VIA, that is visual inspection and acetic acid, to do the basic pap smear, that's the conventional, and then the liquid-based cytology. And then we have the HPV DNA typing and testing. So if you are able to get your hands on with that, then you can go through basic colposcopy. That's also another course that you go through, and then you do advanced colposcopy, and you need to be certified by another certified colposcopist.
Hey!
Yes, and then you have to do about 150 cases
of screening.
No, that is aside the screening. So you need to do about 150 cases of direct and then indirect supervised colposcopy cases.
Okay.
So let's say you need 150 women who have tested positive any treatment.
Ooh.
So you either do lip or just viewing under acetic acid.
Hey, women, please. Right now, as I'm sitting here, I'm scared for myself. But I'll have to take a quick break, and I'll come back with more of these interesting stories from Caroline. So please stay tuned. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes, it's made in Ghana and the taste is purer hair, quality hair for confident look. A special thank you to Star Bites Airport branch. Guys, come meet, eat and drink. Welcome back, guys, and I'm so glad you stayed on. I still have with me Caroline. Caroline, please, are there lots of cancer units in Ghana? I mean, cervical cancer units in Ghana.
If you say cervical cancer units in Ghana, that's no.
Okay.
But if we say cancer units in Ghana, we also with that we are trying to get Ghana Health Service to infuse cancer protocol. Yes, and then we'll see how we can create lots of cervical cancer screening units in the various OPDs or in the various gynae clinics. So we are trying to get nurses who can do at least the basic screening or the basic hands-on screening via pap smear, and then we are getting them to go out there to set up units or screening units in their facilities, so that at least when you come, you have the basic screening, and then we take it from there.
Oh, okay.
At least it's better than not having any form of screening at all and getting surprised along the line. So no, we don't have cervical cancer units out there. We just have a few screening centers like the Catholic Hospital in Bato, Kolebu at the Reproductive Health Center, Rage at the Family Planning Unit, Makobi Polyclinic at the Family Planning Unit, where we do the basic screening, and a few other places that I tried to help set up their screening.
Oh, that's nice.
Yeah.
But when you were talking earlier, you were saying that over 50% is cervical cancer. Yeah. Why do you think we have high rates of cervical cancer in Ghana?
So there's poor information out there. The education is not forthcoming. People are not discerning enough. And accessibility and cost.
Cost
cost effective. So with cervical cancer, to get yourself screened using a pap smear or just the liquid-based cytology, you need close to 150 Ghana cedis.
That's how much it costs for screening?
For just one screening.
That's the pap smear?
Yes, a pap smear.
And the VIA, you mentioned VIA.
VIA, not a lot of facilities are doing VIA. Yes, but VIA shouldn't cost you more than 50 cedis.
Oh, okay. Why is VIA cheaper and pap smear expensive?
In order for you not to go home without having any form of screening, I think you are better off having a VIA done than going home without nothing.
So what's the VIA? What does a VIA involve?
With the VIA, we use the vinegar, kitchen vinegar, or 5% acetic acid.
Okay.
And then we dump it onto the cervix for 60 seconds or close to 1 minute, and then review to see if there are any changes, cytological changes on the cervix. So these changes, like we said, is visual inspection. So you inspect the cervix that has been damped with the acetic acid or the vinegar, and then you can actually see visible changes with your naked eyes. So if there are changes, you recommend the person to see the colposcopist.
All right.
Yes,
for further
assessment and treatment if need be.
Oh, okay, all right. So how do you think we can reduce the prevalence rate of cervical cancer? Because over 57, that's let's say over 3,000 women dying every year, if I'm correct.
Actually, every 2 minutes around the world, a woman dies of cervical cancer.
Around the world?
Around the world. So as we are talking now, in the next 10 minutes, 5 women are going to die somewhere around the world.
Hey, folks, please, cervical cancer is no joke. If you know you are there, you have never even thought of screening, I beg you, please take advantage of this month and then get yourself screened. Know your cervical cancer status. Caroline, would you say that if we get an NGO who wants to help, I mean, would you say that we need lots of let me just put it this way, do we need lots of NGOs to come on board to help save this situation? Because I don't know what the government is doing about this kind of statistics.
If you're a woman and you value your life, I would advise you don't wait for the government to get yourself screened. We would advise a lot of NGOs and other donor agencies to come on board so we can support women to screen or to get screened. There are a lot of clubs doing otherwise, like Rotary Club International, Lions Club, and all the social clubs around are trying their best to get women have access to screening. It doesn't come cheap. You probably would be in Accra and can afford 150 Ghana cedis. Some screening costs as much as 300 cedis, 500 cedis. There are other women out there in the rural areas who haven't seen 5 cedis before. So would advise that a lot of NGOs will come on board, a lot of social organizations will come on board, a lot of institutions will come on board, try and support this cause. Since this month has been dedicated to be the Cervical Cancer Awareness Month, we will need a lot of your inputs just to send the message there. If not for anything at all, your little and your much can help a woman out there to hear something about cervical cancer or have access to some form of screening, be it VIA, pap smear, HPV DNA typing and testing, which is quite expensive, but at least the basics, pap smear, VIA, would be very much appreciated.
Yeah, but I've heard everything you said. In fact, we've all heard you. But let's face facts. Can't the government put at least VIA even on insurance?
Government is trying, but I pray and hope that pretty soon we'll hear some positive feedbacks from government. It hasn't been easy with national health insurance protocols, but I strongly believe that National Health Insurance is going to come up with a package soon. There's so much going on National Health Insurance, but we are trying to include cervical cancer screening, if not for anything, at least for the basics. But we will also impress on government to include just maybe a portion, or for the insurance to include just a part of the treatment, because there are so many women out there who've been diagnosed of cervical cancer and can't afford treatment because treatment is so expensive, and a lot of them are dying. They are dying every day. Like I said earlier, out of all the women around the world, every 2 minutes, 1 woman dies of cervical cancer. So we would appreciate it if government can absorb just a part of the cost, if not the entire cost of cervical cancer, because breast cancer is on National Health Insurance. And I think the life of that woman who has cervical cancer equally matters as the life of the woman who has breast cancer, and also with insurance covering her bills. I think we should do same for cervical cancer, because considering all the gynecological cancers that are diagnosed in Ghana, 57.4% is not a joke.
Yeah.
That is more than half of the entire number of women that are diagnosed of cervical cancer annually. So 57.4%
It's no
is
joke.
not a
Yeah.
joke.
Yeah.
So I think that they are not just dying because they want to die. They are dying because it's outrageously expensive, and then we would impress on government to absorb, if not all, just a part of the cost for treatment, and also try and make screening free, because the more we screen, the more it improves the number of people who are diagnosed of cancer. Because the earlier you screen, the earlier you get treatment, and then we prevent cervical cancer. Ideally, when you have your screening and then you test positive, it doesn't mean you have cervical cancer. It's just a precancerous lesion that can be treated. Because if you test positive and nothing is done about it, giving you 10 to 15 years, it may change into something else that you probably may live to regret. So if you test positive, don't relent on your treatment. See a colposcopist. Have your treatment done. It could actually be nothing. It could just be a vaginal discharge or one of these infections. But once you test positive, go out there and have your colposcopy. Screening, screening, screening. Please go out there and screen. It doesn't hurt to screen. It doesn't cost much to screen.
Caroline, so recently I was reading an article online. It says that WHO has declared a first ever global commitment to cervical cancer-free future. I mean, I think it's amazing. It's good news. But what do you think? What do you think are some of the things that can help WHO achieve this?
Okay, so first of all, I think WHO can, through the government, empower other facilities to put up more screening units, empower NGOs like Cervical Ghana to make screening accessible to the women out there. I mean, to achieve this goal, it's making screening accessible to all the women out there, all the women inclusive. So once you're a woman from the age of 19 years and you are sexually active, walk into any facility and have yourself screened. Once you are sexually active, you are exposed to the virus that causes cervical cancer.
Okay.
And it can be harmful if you don't get tested or if you don't get screened. So there are NGOs out there who are doing a lot just to help with cervical cancer. And then to help cervical cancer patients out there. But to achieve a cervical cancer-free world, I think screening is the way to go.
Very important. Oh, okay, all right. Thank you so much, Caroline. I've really enjoyed, I've learned a lot, honestly, and I know that our viewers too have been well informed. We are so grateful that you came on the show. Thank you. Health in the Spotlight is proudly sponsored by Rina's Couture, designing clothing that suits your taste, giving you a chance to be you. H.I.T.S Ultra Sanitary Pad is the safest and healthiest organic pad every lady needs to use. Royal Atlantic Tuna Flakes. It's made in Ghana and the taste is pure hair, quality hair for confident look. A special thank you to Star Bites Airport Branch. Guys, come meet, eat and drink. Cervical cancer is so real, and the number of women, Ghanaian women that are dying out of this condition, it's very horrifying. So please, government, if you can put the screening as part of the insurance package that you have in Ghana, it will be so helpful. And then also, recently, WHO declared globally a commitment to a cervical cancer-free future. So we please plead with WHO to also work or liaise with local NGOs so that we can help solve this pandemic. It's not only COVID that is a pandemic. Please, women, we love you so much. It's best that you stay safe, you protect yourself, and then you get screened and detect early so that you can be saved. So please, take this opportunity in January as a cervical cancer month and know your cervical cancer status. Thank you so much, viewers, for watching.